I'm happy to share with you some of the experiences we've had in adjusting to COVID at UT Southwestern, but I'm bringing in some other experiences of other academic medical centers. This is really not about COVID imaging findings. It's about the process and the people and how they've been impacted and how we've adjusted to try to make the system work as effectively as possible. I will have some experiences to draw upon that I think are relevant to all practices. We've stumbled across a few findings that I think are interesting and important, and you may find as well similarly. Some of these disclosures here are listed, all of my disclosures, and none of these are particularly relevant to this talk. Well, how could you ever talk about COVID without having an image of a Zoom or a Teams or some kind of digital platform in which we are participating together remotely? In the upper left, you're seeing just a snapshot from a SCARD meeting. That's the chairs of academic radiology departments. Beneath that is a session in which we're teaching women from General Electric and higher level associate professor women in academics to be rising in the corporate ladder for GE and rising to be chairs. And these have been effective and they've been maintained. This program initiated by Sherry Kennan at University of Alabama has really been an important tool to promote women into leadership positions. And fortunately, these platforms have enabled us to continue this. In this particular example, there was a session on coaching delivered by a fantastic colleague at General Electric. This is a display of a little bit more fun. So this was our holiday party. We have one every year. It's been held, I've been chair at UT Southwestern for 10 years. We've had one every single year, and it's a really important bonding situation. Now, to stare at people for 2 hours is kind of awkward and it's not particularly interesting. So you have to be creative in these events. And here what we did was we actually partnered with a vendor and we had a casino night. So we had fake chips and we had different rooms and people were able to move around. I highlight this because it's really important that these virtual sessions touch on the connecting and bonding, because we found a real challenge with people feeling disconnected. Depression has increased. You may know that a lot of suicides have been increasing throughout our population. It's something we're all going through. So the goal ultimately is to try to change and transform what we see as the lemons into a COVID lemonade.